Hi guys, I'm Dr. Jen Simons here with Walker Road Chiropractic, and today I want to talk about 4 uses for a racquet ball. Patients always want to know why I always have one in my pocket, my desk, my purse. I'm never without a racquet ball, and so I want to give you 4 tips that you can use for self-massage at home to work on some of the aches and pains you have and to keep you loose between adjustments. The first one is suboccipital muscles. Those of you with tension headaches, those of you who sit at a computer for a long period of time or look down to read or to knit, things like that, get really tighten these suboccipital muscles, and that tension can lead to tension headaches and is miserable and uncomfortable. So we can use a racquet ball, and you can roll that with your hand along each side of the base of the skull, and when you come to a tender point, I just want you to gently press your head into the ball, and I want you to hold it there for a few seconds, and as you feel that muscle release, go ahead and move on and continue to roll again, and then you're going to want to go ahead and do that on the other side. So suboccipital muscles, the neck is one good use for it. Another one is the feet. If you're someone who has plantar fasciitis, if you're someone who has really sore, miserable feet, if you stand on cement floors for a long time, all day at work, these kind of people do really well with rolling out the feet first thing in the morning. If you have plantar fasciitis, many of you know that when you get up first thing in the morning and you put your body weight on your feet and you already have tight plantar fascia, you get little micro tears, which then cause you pain and misery the rest of the day. So rolling out your feet first thing in the morning helps to loosen them before you step into gravity. So sit up out of bed, put your feet flat on the floor but don't stand up yet, and put the ball under one foot at a time and roll forward 10-15 times, roll backwards, and every time you find a tender point, I want you to rest into that, and as you feel it release, go ahead and move on, and then I want you to start your day and see if this helps adding that in. So we've got the neck, we've got the feet. Another way to use this is between the shoulder blades and into the upper traps. A lot of people have a lot of tension in their upper back. Sometimes people come in and they say, adjust my neck, but what we find is if we work the area in the upper back, which is a coupled motion between those segments in the upper back and the neck that affect rotation of the neck and the way the neck moves, we often get a lot of relief. By the time we get to the neck, there's not much left to adjust. So you can take this ball and you can put it on your back between your spine and your shoulder blade, starting a little bit below your shoulder blade in that area between those two, and you can press up against a wall, a door, and you can roll. And when you find a tender point in those rhomboids, I want you to press into it and rest, and I want you to wait for it to relax, and then you can go ahead and move the ball up a little further, and again roll out some of those tight muscles, and as soon as you find a tender point, a knot, rest into it until it starts to melt away. And you can continue to do that on both sides. You can actually come pretty high up and actually get up into those upper traps that get so tight, driving, sitting at your desk, doing those kinds of things. So neck, feet, between the shoulder blades, upper back, and last but not least, you can actually use this to work on your hips. A lot of times when we get hot low back patients, as we call them here, their low back has either gone out or is really spasmed and they have very little mobility. Many of the stretches that would help them, they can't get in that position yet to loosen up their back, so they feel like they're not sure what to do. We often recommend taking a racquet ball or a tennis ball and either laying on the bed. For those patients, we don't recommend getting on the floor as it can be hard to get up, but if someone is not having that really acute low back, just feeling tight in the low back and the hips, you could lay on the floor. You could press the ball around the side of your glutes, around your hip, into the wall. You could do this on the bed again, and you put it into the side glutes around the hip, and you just roll around those muscles, and again, when you find a really tender tight spot, you rest into it, and then you move again, and you can do this on both sides. So you can use this ball to work out your hip muscles, side of your glutes. You can use it for your feet, your suboccipital muscles to relieve tension headaches, to relieve those tight muscles, and between your shoulder blades and your upper back. So for a couple dollars, this is a really smart thing to have in your arsenal. You can use it when you travel. You can keep it in your purse or in your desk at work. Try this out. Let me know if you have any questions or concerns. If you are feeling like a certain exercise is not working for you, if you feel like you need something else to get you through your day and to keep you loose between adjustments, check in with Dr. Gardner at your next appointment, and we will give you something to use as a tool to keep you on track. Dr. Jen Simons here with Walker Road Chiropractic. Have a great day.